So as I mentioned for this intro part, the last thing I kind of want to wrap up with is one, I'll talk a little bit about careers in psychology, but I wanted to because if you notice in our introduction part, the majority of the individuals, if I think all of them, were made up of white European males. Okay, if we you look at the humanistic theory, Freud's theory, and learning theory, a good number of those early theories were promoted by or came up with by European white men. Um, but I just wanted to note that there is a growing diversity in the field, and that it's not just these individuals that we look at in the past that really make the field what it is. So I kind of wanted to kind of go over some of the individuals, and and she's not listed on here, but I am going to just say in my own personal world, there's a individual by the name of Susan Fisk, Dr. Fisk. Yeah, really inspired me to start studying areas of identity and social belonging and loneliness. First, by starting to read one of her books called Social Being, Core Motives in Social Psychology, where she sets up the cognitive reasons that we need other people in our life. And then she gets into the neurobiology and all of those things. But she's been one of the leading figures in this idea that humans are social beings, that we cannot exist in a silo of our own and expect to survive. So I just wanted to mention that from a personal basis. And my master's thesis was a industrial organizational psychologist from Canada who she uh, runs a center for leadership development. And she talks with many of the Canadian top CEOs and corporate leaders and does corporate training for them. So those are two major influences in my life that I think are worth noting. But what I just want to express here is that women have had an influence throughout psychology. In fact, in the early 1900s, well, 1900 to 1930, we get our first APA president that's female and who advanced the research on memory and the self, and she came up with this idea that memory is something personal. It's not this objective thing, that it has something to do with the individual. And when we get to memory, we will note that anytime we can make a personal story out of something, the more we can connect it to our personal experience, the better our memory of it is. And it really started with research from her. Okay. Margaret Washburn was a pioneer in what's called comparative psychology and animal behavior. So, comparative psychology is the ability and the limits of using studies of behavior in animals and translating that into behaviors of humans. And she set up some early work about the limitations and the potentiality of comparing, for example, the behavior of a mouse or a pigeon with that of a human. And she made some compelling arguments, but also um, said that it's not, it can't tell the full story. We can't just look at another species because they have different sensory abilities, different movement abilities than we do, and directly translate it into human behavior. So, and then of course the psychoanalyst Anna Freud, Sigmund Freud's daughter, really advanced the idea and theories of child development. She separated a lot from her dad's notion of sexuality and really solidified the importance of early child development. She's also even though Sigmund Freud is credited with it, she's actually the one that started the notion of defense mechanisms that we need to protect our ego. So sometimes, for example, we'll go through denial. We'll deny that we diagnosed with some sickness or deny that someone passed away. Repression, and that's forcing a memory down to where it can't be recognized, or regression, acting in an earlier state than, and all of these are temporary defense mechanisms in a sense. So, and then Karen Horney uh, kind of got rid of the male-oriented theories and the high idea of sexuality and suggested that our personality is more towards social and cultural influences than they are necessarily internal unconscious drives. Okay. And then some other individuals throughout history, especially within the areas of social and developmental psychology, we have different people talking about the one that we will definitely be talking a lot about is Mary Ainsworth when we talk about attachment theory here in probably about 2 or 3 more weeks. And she came up with a way to test your a child's attachment style by using the strange situation scenario, which we'll get to. But she had a huge influence on developing what is a secure attachment, what is a insecure attachment, what is an anxious attachment, and those kinds of things, and how do they relate then to adult behavior. Dr. Clark, Mammy, she did research on racial identity and self concept, and her work actually influenced, if you remember the famous case of Brown versus the Board of Education, where he was being denied access to education. She did a lot of research on how integration can reduce prejudice and reduce a lot of different social ills that existed at the time. And that research was used during this case to make the argument that schools should be integrated. Okay. Um, and then just a few more uh, psychologists from marginalized groups, and it includes individuals like Francis Summer, who was our first American PhD psychology and founder of what's known as Black psychology. Prosner, who did a lot of work on identity and education. We see Miss Clark Dr. Clark up here as well, and a lot of things on things like rights and policies is a major theme. We will get to, when we get to the learning section, we'll look very closely at what's known as social learning theory and self-efficacy, which came out from Albert Bandura. And then Dr. Win Su is a person who started to develop the idea of microaggressions, which in its beginning was very, very controversial, because on the very objective little research end, there was no evidence for it until we started looking at it from a multicultural perspective and a cultural competency perspective. And he's the individual who showed that microaggressions, yes, do exist, and they sometimes are outside our awareness when we're using them, and also what the negative effects are. And we'll get into some research from Wing Su when we get into social psychology that shows if you reduce the amount of microaggressions, individuals will not act towards their negative stereotype. And so we'll look at that and the importance of that when it comes to social situations. And then probably a very important area of psychology right now is what's known as Native American. It's also known outside of the United States with other Native groups as indigenous psychology. And I actually have had the honor of working and speaking. I actually get to talk with Dr. Gon every Friday at a um, uh, uh, Society for Indian Psychology meeting we have every Friday. I met Edward Duran. I hope someday to meet Dr. Maria Yellow Horse Braveheart. But for Native American psychology, what a major focus really has been on is things like healing and mental health. That's been a major area so far within the field of Native American psychology. As you can see, for example, Dr. Gahn did a lot on historical trauma, but also notes the idea about community-based healing. And he's really challenged the notion of individual therapy or the Western model of therapy and says it just doesn't take a therapist and a pill to make someone better. It takes the community, and the community needs to be involved in a person's healing. Dr. Yellow Horse Braveheart has done a lot with historical trauma and historical trauma response, especially coming from things like colonization, boarding schools, and integration loss and effects on Native mental health. And she really has been kind of on the forefront of promoting this idea of historical trauma and doing a lot of the edge-breaking research that is showing not only is it something that is real, we're actually finding evidence that it is genetic. There's genetic markers that hold our trauma in it, in a sense. And then Dr. Duran also is promoting this idea of traditional indigenous healing practices, which includes things like storytelling, ceremonies, and spirituality. And if you ever want to read a really good book about the idea of Native American or indigenous healing, the book Soul Wounds, you can get it on Amazon, I believe, is a really good book that kind of gives a different view of pathology. Instead of being a disease state, it's something where a person has kind of lost um, um, their place, both in the land, in themselves, and within their community. It's a really good read if anybody is interested in that. Um, but I do just want to note some core contributions of Native American psychologists because they are having a good influence on this challenge of Western ideas, okay, is they're reframing mental health. They shift psychology from that individualistic medical model to a relational community model. And if any of you attended the basics of mental health on Friday, we very much talked about the importance of social identity and making sure you have a strong identity within your culture and your community, within yourself as a core component of good mental health. Okay. And then of course, historical trauma framework. And we will talk about this a lot in week 7 when we get to the abnormal psychology section. And then culturally grounded interventions rooted in culture, ceremonies, elderly, and community as an important component. In fact, in recent research, cognitive behavioral therapy is kind of like a gold star in clinical work right now. And it's pretty evidence-based. It has the pretty much really good outcomes. But we found that by integrating conversations about a person's cultural identity, where they belong, where their people are, who are their people, that it actually increases the efficacy of cognitive behavioral therapy by about 50%, which is really significant. Okay. Ethical and decolonizing psychology, and this talks a lot about addressing things like power, oppression, sovereignty, and cultural respect in research and practice. When we get to a little section on ethics, we will see that individuals in marginalized group and especially Native American and indigenous groups have, I don't mean to put this so crassly, but have been the guinea pigs of research that um, is pretty unethical. That because of Native American psychologists that really came in and worked for change within institutional review boards and government agencies, that hopefully that type of research that takes advantage of especially Native American communities has either slowed or stopped. But we will see later in the course there's evidence that it still continues today. And so there's still a lot of work that needs to be done in that area. All right, so just to kind of summarize the two differences so that we understand kind of the approach we're going to take in this class, because we're going to take both that Western model, but we're going to integrate the indigenous psychology model. So yes, in psychology, we focus on the individual, but in this class, we will also focus a lot on community and relationships and how much that really influences a person's behavior and mental processes. Mind-body separation, that whole dualism. We'll talk about mind and body, of course, but we'll also talk about land being interconnected, your environment, and how important your environment is, and where you are spiritually in those searches for purpose. Okay. When we get to a mental health part, we'll talk about diagnosis driven, that it's mental illness is symptom driven, and our goal should be just to alleviate those symptoms. Whereas in a better, more holistic model, we include things like meaning and lived experience as important parts. And this goes into this diagnostic driven goes into the pathology oriented ideas of Western medicine is what's wrong. Okay. In the indigenous model, we also talk about strength and resilience oriented. If you remember when we talked about this is kind of that humanistic idea that we talked about last week, that we have to be able to look at not only what's wrong with us, but what are our strengths, what are our resiliencies, what happened. And so that's an important part. And then again, in the Western model, the therapist is the expert, whereas really in a community, the community is the knowledge holder, that we should be a community-based approaches towards mental health and those kinds of things. And then, of course, time-limited treatment in the indigenous models, healing is lifelong and cyclical. Okay. So why does this matter? I'm just going to read this. Indigenous models challenge psychology to move beyond symptom reduction towards restoring balance, identity, and belonging. Okay, so I just kind of wanted to show those differences, because if you like this psychology stuff and you're really interested in it, but you're also very much about your community and Native American, psychology still needs a lot of Native American psychologists. There are very, very few. If we look at the percentage of psychologists that are that are Native American, it's 0.01%. So there's a lot of room for growth in this area. And even at 0.01%, Native American psychology has had a huge influence on the directions we're seeing today. So just wanted to put that plug there for anyone who's interested in doing that. Okay. Now, based on all of this, I just want to bring up, this is one of the major models of today, is what's known as a biopsychosocial model. The biopsychosocial model says in order to understand human behavior, in order to understand the reason why a person behaves, is we need to know the psychological processes, what's going on in the mind, the brain, what are the thought processes, the biological processes, what are the neurochemicals, what are the brain functionings, what is going on hormonally and whatnot. And then we need to know the social. What are the social barriers? What are the social resiliency factors? All of those things to understand behavior. So throughout this course, when we're talking about this, we will look at all three of these components, especially when we get to human development. We'll see people change in all of these domains over time, but they have to change in tandem with each other. Okay. All right. Let's see. What else do we have? So I just do want to tell you a little bit about the flavors of psychologists. So psychologists, who are they? Who are we? A psychologist is usually a master's or doctoral degree person trained in methods, knowledge, and theory of psychology. And this is kind of an important note to make because a lot of people assume, clinical counselors, they're not, what's the science part of it? Even if you go into clinical and counseling psychology for, let's say, your doctorate degree, about 60 out of your 90 credits for your doctorate degree will be in research methods and statistics, even when you're doing counseling and clinical, with only 30 credits that will go into practice, theory, and all of those things. And when we get to, for example, treatment, we will see that uh, clinical psychologists and counseling psychologists use a scientific method in order to go through the treatment process. So when we look at these two individuals, these are PhD level or what's known as PsyD degrees. Clinical psychologists tend to treat more severe psychological problems. Counseling psychologists tend to treat milder, such as school or work troubles. And then we have psychiatrists, which are somewhat different. They are kind of our counterpart, but they are medical doctors who then go in the last couple of years of their medical education and specialize in mental health. And they tend to either do psychotherapy and or medication. They may do some types of surgery, those kinds of things. But as we mentioned in the beginning of the class, not all psychologists perform therapy. And that's an important note to make. So let's look at some of the other flavors of psychology. So if we look over here, there's actually over 52 divisions of the American Psychological Association. And here's some of the major kind of non-clinical type of individuals. We have people like neuro and media psychologists who study, of course, media, movies, TV. We have political psychologists. Believe it or not, most senators, most Congress people, most presidents have a political psychologist on their staff because they kind of tell them how to socially interact with different groups. Political psychologists for the president, for example, if they're flying to Beijing, will then kind of tell the will consult the president on social customs, social norms, different personality factors and stuff to expect, and get them prepared to interact with that other culture, as an example. Experimental psychologists do just pure experiments. We'll look at things like sensations and perceptions, learning and memory. All of that comes out of pretty much experimental psychology. My master's degree is industrial organizational psychology. So for quite a while before I got into academics, I worked with nonprofits who were having financial difficulties, were having performance issues. And I would go in and I would analyze and determine what are the behaviors and cultural norms and everything that are driving that dysfunction, and then help them design programs to fix those. Um, if you do want to make the most bang for your buck in your education in psychology, industrial organization psychologists are the most well-paid psychologists within the field. A person going out of IO psychology, coming from a good program at the master's level, usually is making six figures within about 6 to 12 months of graduating. So it is a very lucrative field. I took the wrong route with that one because I worked with nonprofits, which wasn't so profitable, but it was also really fun. Um, so these are some of the different flavors of different areas of psychology that you can consider. And then there are some non-clinical, some job outlooks right now, because of the things that have happened with, for example, COVID and everything else. Um, Social and personality psychologists are very sought after. Of course, neuroscientists, neuropsychologists, but probably the field that is getting the most in psychology, that is getting the most need right now, is our quantitative psychologists, our data diggers, our people who can go, for example, and get data for Facebook to help their developers get people to use Facebook more. And do large amounts of data analysis. That tends to be the most non-clinical field of need right now. Okay. As I mentioned, non-clinical, non-academic IO psychology is probably the highest earning of them. In clinical, unfortunately, we have a lot of clinical folks, so it's very highly competitive. And it's highly competitive because I think we all can see the need for mental health in this country, especially. But unfortunately, because we live in a capitalist society, organizations have had a hard time developing a financial model that makes it a highly lucrative field. I know that sounds awful, but I'm speaking the way our economy works. And so until someone invents a way to make money off of mental health, there's very few organizations. There's a high demand, and because of that high demand, there's a lot of people going in the field, which makes it highly competitive because of the lack of organizations that are out there providing services to communities. So just something to consider if you're considering going into that mental health area. Um, okay. And then there are some other mental health professionals. Hello to the social workers in the room. I'm happy that you're here. We have counselors who are master's level people, usually with a psychology degree, who tend to work with minor mental health, married schools, and so on. Psychiatric nurses and paraprofessionals who work in these human services and mental health fields. So those are some of the kind of non other mental health professionals who tend to usually have a bachelor's in psychology, but then they have training in other areas, except for our amazing social workers who have their degree in social work. So, and yes, so okay. All right, so that is that. I'm going to stop sharing for just a minute.